We're discussing the different options for breast augmentation incision. There are 4 possible incision sites for breast augmentation. I'm going to discuss these in the reverse order of which I think are the most reasonable and the best options. So the option that I think is the least reasonable option is through the belly button. There's a procedure called TUBA, T-U-B-A, trans-umbilical breast augmentation. It's where you insert a saline breast implant through the belly button. In my opinion, this is not a reasonable incision and it's not a reasonable option. There is no way to, first of all, get a silicone implant in through that incision, and you can't really properly dissect the breast implant pocket under direct vision. Therefore, I don't use that incision. The second incision is in the armpit. I also don't use that incision. There are several reasons. The incision is located away from the breast, therefore it's more difficult to visualize what you're doing as the surgeon. In addition, it's located in an area that is exposed to the world. If a woman is on the beach and she happens to lift her arms up, now everyone on the beach knows that she had a breast augmentation. So the scar is not well hidden and the incision site is far away from the field of surgical dissection. So again, you can't create a great pocket. The 2 best incision sites are in the breast fold and underneath what's called the nipple areolar complex. I tend to do almost all of my breast augmentations in the transition point between the nipple areolar complex and the breast skin, commonly known as underneath the nipple. In the breast fold is also a reasonable option. However, when you make an incision in the breast fold, you're placing a scar on open, clean skin with no natural transition point. Therefore, when you look at that scar, it's more obvious. When you place a scar in the transition point between the nipple areolar complex and the breast skin, your eye already expects to see a transition there. The nipple areolar complex is dark, the breast skin is light, your eye expects to see it, so you can very easily hide a scar there. It tends to heal beautifully. The surgical procedure is slightly more technically challenging for the surgeon, but that should have no effect on your decision, because if you have a talented plastic surgeon, then that should have no effect on complications, surgical time, or anything else. So those are the 4 options you have for surgical incisions for breast augmentation. But again, the infraareolar incision, in my opinion, is the best option.